scan will be the second scan of your pregnancy and is usually performed between 18 and 21 weeks of pregnancy. It is normally referred to as the 20-week scan, but also known as an anomaly scan or a mid-trimester scan. The purpose of this scan is to check the development of the baby, to check the baby's organs and body part, to detect any abnormalities or anomalies, and to also take measurements of the baby to make sure that it's growing appropriately for its age. This is a really exciting time and you'll be able to see how your baby is growing on the scan. And at this scan, you may also be able to find out the gender, but you'll need to ask the healthcare professional who's doing your scan to see if you can find this out, if this is something that you wish for. Having this scan is safe and doesn't pose any risk to you or your baby, and it provides you with important information about your baby. But it is your choice whether to have this scan or not, and your midwife will be able to provide you with information about the purpose and implications of this scan for you to be able to make an informed choice. During this scan, the healthcare professional will be looking closely at your baby's heart, its lungs, its brain, the kidneys, the spinal cord, its bones, the face and the abdomen to make sure that everything is developing the way it should. And they will also be looking for 11 rare conditions. They can only look for these conditions, and unfortunately we can't always determine or see everything that is wrong. So it's important to be aware of this when you have the scan. And they will also take a look at your placenta, the umbilical cord and the amniotic fluid to make sure that everything's okay, and to also see where your placenta is lying in your womb. If the healthcare professional finds or suspects that something is wrong, then they may request a second opinion from another colleague to come into the room. And if this is the case, you may be offered further testing, but they would go through this with you and discuss all of your options. But it is reassuring to know that in most cases, the ultrasound shows that the baby's developing as expected. When you attend for the scan, they'll ask you to lie on a couch and expose your stomach, where they'll put a small amount of gel on your stomach to be able to do the scan, as this will give better contact between your skin and the probe that they use to do the scan. And the screen will usually be by your side where you'll be able to see your baby. It may be difficult to know what you're looking at first, especially if the baby's in a difficult position, but you may be able to see the arms, the legs, the face and the head. So do have a look out for this. But it may look a bit different than your 12-week scan because the baby is more developed at this stage, so it is really nice to see. Having this scan shouldn't be painful, but it might be a bit uncomfortable when they put pressure on your stomach to take the images and to also measure specific body parts and organs. So just be aware of this when you do go for the scan. The healthcare professional doing your scan will need to focus when they're doing the scan, and they may keep quiet, but this isn't anything to worry about, because at the end of the scan they will talk to you about all the checks that they've done and the results, and they'll also provide you with your scan photos to keep as a keepsake. If you're considered a low-risk patient, it is unlikely that you'll have any more scans after your anomaly scan at around 20 weeks. But it's important that you know that you'll have your regular checkups in the community area, and if your midwife has any concerns about the growth of the baby, then she will make a referral for you to have further scans at the hospital, but you'll be made aware of this. But yeah, I hope this video has covered everything. If you have any questions, then please let me know, or if you want me to cover anything specifically, then please let me know your ideas and I'd be more than happy to make a video on it. I just want to help as many people out there as I can. But yeah, I'll see you soon and thank you so much for watching.